So inpatient treatment is our most intense level of psychiatric care. It's our most restrictive level of care, and it's usually dictated by urgent circumstances. When these lower levels of care no longer are enough to support an individual, or maybe a little bit longer term treatment is needed. So it's appropriate for individuals who are at risk of harming themselves, imminent risk of harming themselves, or are in a really kind of acute or significant phase of their mental health symptoms that requires a secure setting, 24-hour observation, and just really, feeling like they're not well maintained in community settings that are voluntary. Typically, individuals stay long enough to be, I'm going to use the term stabilized, but stabilization is from the acute episode. It's not to say that they're better, that the recovery has happened, wellness has happened. It's really, we're looking at several days to maybe up to 2 weeks. Certainly there can be longer stays, but I don't think that's the typical experience before someone is released. And then the recommendation is to then engage in treatment elsewhere, right? So ideally, if we could move between levels of care, someone would be step down to a community crisis stabilization unit, or maybe to a partial hospitalization, and then down to outpatient. But oftentimes those beds aren't available. And so resuming outpatient might be kind of the next step. While people might have individual check-ins and medication management in an inpatient setting, definitely some group therapy, the treatment that happens there is not as intensive, I would say, as an outpatient setting, which may not seem to line up for people, but this deep work, this kind of more intense work that ultimately I think people need to do to move through what they're experiencing, there isn't the time to have that happen on an inpatient unit. There isn't kind of the support to do that in terms of all the other people that are there. And, it's about stabilization. So it's not about kind of churning things up. It's about helping people get back to a better place to then be able to go do that work. So I would say a lot of the individual work that's happening on inpatient psychiatric units is more about planning for discharge and what that needs to look like. And certainly family members and caregivers should and can be part of that, but it's not intensive therapy. As I said, this is the highest level of care. It's the most restrictive, especially when it becomes involuntary.